Greetings and salutations. Thank you for lending an ear to The Voice of the Times this Wednesday, January 6, 2021. For today's editorial, Pharma zones an idea worth considering. Senator Francis Tolentino thinks the Philippines should become a center for pharmaceutical research and production, and we think he may be right. Tolentino last week filed a resolution calling on the Philippine Economic Zone Authority or PEZA and Board of Investments or BOI to develop pharmaceutical manufacturing zones in the country. The effort would spur investments, facilitate patients' access to innovative drugs to treat critical illnesses, lower the cost of medicines for Filipinos, and fast-track socio-economic growth in general. The resolution explained. To support the call, Tolentino cited a 2019 survey conducted by Pulse Asia in which 99% of the respondents said they could not afford prescription medications. The troubling lack of access for Filipinos to vaccines against the coronavirus disease 2019 or COVID-19, highlighted by President Duterte's own security detail apparently having had to resort to illegal means to obtain theirs to ensure that they would be able to continue to protect the president, is obviously also a driving factor behind Senator Tolentino's resolution. To Tolentino's credit, however, the resolution focuses on the longer view of encouraging the development of an entire vital sector, rather than dwelling on the short-term, albeit rather large problem of COVID-19 vaccine access. Even the most casual observer would recognize the positive implications of having a robust pharmaceutical industry in the face of the current or any future pandemic, so the advantages do not need to be discussed in great detail. From a broader perspective, focusing on building up a pharmaceutical sector would have even greater positive effects than the resolution suggests. Although there is something of a pharmaceutical industry in the Philippines already, including one dedicated economic zone located in Bulacan, much of the medicine the country needs to manage its endemic health problems must be sourced from elsewhere. This has made it more difficult to manage some persistent diseases such as tuberculosis, HIV/AIDS, diabetes, dengue fever, and cardiovascular disease, as well as illnesses such as measles and polio, which should not be serious public health concerns anymore, but occasionally still are. The pharmaceutical market in the Philippines, according to Tolentino, accounts for about 146 billion pesos in economic activity per year. A significant part of that flows out of the country through the import supply chain to pharmaceutical developers and manufacturers overseas. Keeping even part of that within our own borders would, as the senator suggested, provide a substantial boost to the economy. There are also geopolitical implications to having a robust domestic pharmaceutical industry. The effort to acquire supplies of the various vaccines against COVID-19 has been complicated by worries over whether those acquisitions might come at the cost of making undesirable political compromises with the governments of China, the US, Russia, or others. If the Philippines was home to pharmaceutical laboratories and manufacturers capable of producing vaccines here, however, not only do those political questions disappear, but the situation also completely reverses and gives the advantages of being a potential supplier to the Philippines. Other benefits that are somewhat more intangible but no less important include the value of intellectual property that could be developed here, as well as the boost access to cutting-edge commercial pharmaceutical research and development could provide to the Philippines' own medical education and research efforts. Likewise, the Filipino people, by virtue of being a large and easily accessible test population, would presumably benefit from more effective, higher-quality medicines. Any good idea can be implemented in the wrong way, of course, so PEZA and the BOI, if they are inspired to take up Senator Tolentino's call, must proceed carefully in developing a pharma zone plan. Care must be taken to avoid the situations that have arisen with other economic zone industries that simply exploit low costs and favorable terms here to create added value for the home countries. Creating an attractive environment for pharmaceutical investment while ensuring that the substantial long-term benefits represent a profit for the Philippines is imperative, but it is certainly not impossible. We believe that it is a worthy objective. And that's the editorial for Wednesday, January 6, 2021. For more news and information, get a copy of the Manila Times on print. Subscribe to our digital edition or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram. And listen to The Voice of the Times.